This is the 2-minute warning. For reporters on the line, please dial 1 to ask a question.
Good afternoon. I'm Dr. Mandy Cohen. I'm the Secretary of the North Carolina Department of Health and Human Services. And today I'm joined by Dr. Charlene Wong, Assistant Secretary for Children and Families and practicing pediatrician at Duke. Monica McGee and Lee Williamson are American Sign Language interpreters, and Jasmine and Jackie Matevier are our Spanish interpreters. As far as today's COVID numbers, as of this morning, there were 2,156 new cases reported just today. 1,095 people are currently hospitalized right now with COVID across North Carolina. And sadly, there have been a total of 18,371 deaths from COVID. While we as a state remain in the red zone with the highest level of COVID transmission, our trends have improved significantly, which is exactly what we want to see. We also have made great progress in vaccinations. More than 72% of adults in the state have received at least one dose of a COVID-19 vaccine. And this month, we reached another significant milestone in our fight against COVID. Children ages 5 to 11 can now receive a safe and effective COVID-19 vaccine. Last week, the FDA authorized and the CDC recommended all children ages 5 through 11 should get a lower dose of the Pfizer COVID-19 vaccine to protect against serious illness. Just like other routine vaccinations for kids, the Pfizer COVID-19 vaccine underwent a thorough testing and review process by the FDA and an independent scientific committee to ensure it is safe and effective for children. They reviewed data from clinical trials, some of those which were conducted right here in North Carolina with more than 3,000 children. The data shows that the lower dose of the Pfizer COVID-19 vaccine protects kids from serious illness and that there were no safety concerns or serious side effects. Having a safe and tested vaccine for our younger kids is fantastic news. Children, as you know, are vulnerable to COVID-19 just like everyone else. While kids tend to get less sick than adults, unfortunately, kids do get COVID and can experience some of those longer-term symptoms like headaches or memory loss and muscle fatigue. We also saw more kids hospitalized this summer with the more contagious version of COVID, the Delta variant. Additionally, kids are at risk of a rare condition called multi-system inflammatory syndrome in children, or MISC, after getting COVID. During the most recent surge, pediatric cases of the virus rose by more than 200% across the United States. As a parent, having a safe vaccine to protect my young daughters from COVID-19 is a huge relief. My daughters were vaccinated this past weekend because I want to do everything possible to keep them healthy and to get them safely back to the things they love. Like most kids, my daughters don't like shots, but we talked as a family about the reasons it was important to protect them from COVID, just like we protect them from flu and other childhood illnesses like chickenpox. We are sharing our family's COVID vaccine experience in our new PSA videos. We'll take a look at it right now. Hi, this is Dr. Mandy Cohen, Secretary of the North Carolina Department of Health and Human Services, and I'm here today at our pediatrician's office getting our COVID-19 vaccine. So these are my daughters who are 7 and 9. This is Evelyn and Sophie. I could not be more relieved to get them their vaccine today. We know that this vaccine has been through a rigorous clinical trial. I've gotten the chance to look at that data myself. We love our kids so much, and we want to make good decisions for them and their health. And I was really happy that we have a safe and effective COVID vaccine. And I was really proud of them today that they got their vaccine. It was a huge sigh of relief for mom. So I hope everyone goes out and gets their COVID vaccine for their kids as soon as possible.
Everyone 5 and older can get a COVID-19 vaccine. Visit myspot.nc.gov.
Proud mama. So already more than 24,000 children in North Carolina have received their first dose. Like adults, children are given 2 doses of the vaccine. However, each dose is about 1/3 the amount given to people ages 12 and older. Children between 5 and 11 should not receive that larger 12 and older dose. Children, like adults, can experience temporary side effects from the vaccine, like older kids, including temporary arm soreness, headache, being tired or achy for a few days. I'll share that my daughters didn't have any side effects from this first dose, not even a sore arm, but we know every kid is different. We have plenty of vaccine supply across the state. Kids can get vaccinated at any location that has this smaller dose of the Pfizer vaccine available. This includes their pediatrician or doctor's office or hospital. Unlike other vaccines, younger children can also get vaccinated at local pharmacies and grocery stores, making it even easier for parents to find a convenient location for them. We've also worked with community partners to set up 9 family COVID-19 vaccination centers in historically underserved communities to make sure vaccine is easily accessible. These centers will be operating for the next 6 weeks, and they have vaccines for all ages as well as boosters. They're open during the evening and weekend hours. They have live Spanish interpretation and have people on site to answer questions. And remember, COVID-19 vaccines are free to everyone, even if you don't have health insurance and regardless of immigration status. You can find vaccine locations at myspot.nc.gov. We also have information on our website about how to talk to your children about the COVID-19 vaccine. If you still have questions, talk to your child's doctor. You can also visit myspot.nc.gov to get accurate information. Don't wait to vaccinate your kids. Vaccination helps keep children healthy and helps them be safe in the classroom, playing sports, and attending events and other activities they enjoy. With that, Dr. Wong and I will now take your questions. We'll start here in the room if you have any. Yeah, Jonah.
Nice to see you, Dr. Cohen. I haven't been here in a while, so forgive me if I have a couple extra questions here.
Sure.
You have a new group eligible for vaccination. It gives us an opportunity kind of to reset the message. We know the vaccine is extremely effective at keeping you alive and out of the hospital. Can we set the record straight, though? Does the vaccine lessen your chance of getting infected in the first place? And if so, by how much?
Well, first, Jonah, thanks for that question. I want to make sure parents know that this vaccine is effective at keeping their kids from getting COVID in the first place. What we saw in clinical trials was a 90% effectiveness from those clinical trials, meaning effective at preventing the child from first getting COVID. And we know that's the first step in preventing them from getting really sick from COVID. If we can prevent them from getting COVID in the first place, that means that they're not going to be at risk of getting a severe reaction to COVID if they get it, to get hospitalized, or to get that rare inflammatory disease that I mentioned.
So you mentioned that Miss C, I can't pronounce it,
That's
but
right,
we
Miss
know there's measles, mumps, rubella, smallpox, chickenpox. These are dangerous diseases for children. COVID, yes, you mentioned there have been some extreme cases, but in the Wall Street Journal this week, Two physicians, one from Sloan Kettering, one from Cornell Medical School, reported of the 28 million children between 5 and 11 in America, 94 have died, 562 have been hospitalized out of 28 million. I'm not good at math, but that's a very, very tiny, tiny, tiny percentage. So with that as the pretense, why is this an emergency that children should get vaccinated now and not wait a few years for more research?
I think this is a great question because we want to remind folks that even though the risk of hospitalization and death are rare in children, as well as this inflammatory condition, it is possible. And now we have a safe tool to protect our children. I'd equated, and I want to have Dr. Wong weigh in too, right, that we all, for example, use car seats or seatbelts with our kids, even though the risk of dying in a car accident is pretty rare for a kid, which is great. But we want to do everything we can as parents to protect our kids. And so I see the vaccine, because it is safe, as one of those really effective tools to protect our kids. Let me turn it over to Dr. Wong to add more.
Yeah, thanks for the question. I think, importantly, any preventable hospitalization or preventable death in a child is very worth it. To also put it into context, it is a small number. Fortunately, we don't have that many children who die each year, but in 1 year with COVID-19, it has become it's been in the top 10 list now of the things that are killing our younger children. And again, every death of a child that we could have prevented is a true tragedy. I will also just say, as Dr. Cohen was mentioning, we have lots of kids who are getting really ill, over 50,000 in the country, who have not needed to go into the hospital. Fortunately, many of those children, we're able to give them treatment, support them, and have them come out. But certainly we don't want any child to go into the hospital, and the family who is, having to deal with that stress going into the hospital if they don't need to, because we have this safe and effective COVID-19 vaccine.
For young, I think in the tweens, we knew about some cases of myocarditis in young males in particular. What do we know about that as a side effect in these trials? And here in North Carolina, do we have any cases of that in so far those immunizations?
Sure. Let me turn it over to Dr. Wong again. Thanks.
So in the clinical trials, we didn't see any of those myocarditis cases in the children ages 5 to 11. There are a couple of reasons we think that's the case. So number one, the dose of the vaccine for our 5 to 11-year-olds, it is smaller. And it's smaller meaning that they are going to have, less, in part because we didn't want them to have so many of those temporary reactions, but still wanting to make sure that it's effective. Fortunately for us, our younger children have very robust or strong immune systems. So when we give them a vaccine, even better than adults, they are able to really mount that robust protection or immune response that we're looking for. And so because we knew that they had that more robust immune response, we were able to bring that dose down, which also meant that we would see less of these other temporary reactions or more serious side effects like myocarditis. In addition, the myocarditis syndrome we know happens more often, not just with COVID, but myocarditis happens from other viruses too. This is something that we see as a practicing pediatrician. Sometimes we see kids get myocarditis or its cousin pericarditis when kids get other viruses too. We know that we see this more often in general in our older teens because some of that has to do with the hormones and puberty and sort of how that affects the way that their bodies react when they get infected with these different viruses. And so for all of those reasons, number one, we were glad to not see any cases of myocarditis in the clinical trials, and there are some pretty good reasons we think that's the case, and it'll be lower risk in these children. Of course, we will continue to monitor with the CDC, the FDA are continuing to monitor for any of these rare side effects in the younger age groups as well.
Dr. Cohen, in your fireside chat that you had last night, one thing you mentioned was that it's still much better to not have COVID at all than have COVID. Can you talk about the risk of a long-haul COVID? So if hospitalizations are low and death is also very, very low, that risk, what is the risk of a long-haul COVID case and how prevalent is that in children?
Yeah, so I'll start and I'll want Dr. Wong to weigh in as well. But what we are seeing, I think we are only at the beginning of understanding what the long-term impacts of having COVID are. Even for those who have a mild COVID illness, we are seeing that children can have longer-term side effects, fatigue, headache, muscle aches, lethargy, again, different kinds of tiredness. So we are seeing that in children and adults. And so I think what we want to do is say, well, look, we have a tool here that is safe and effective at preventing your child from getting COVID in the first place. Let's use that safe and effective tool to make sure they don't get COVID. I think we are still learning to understand, again, over time, how long is long COVID and how long will it last? So let me turn over to Dr. Wong.
Yeah, when my patients and my parents ask me this question, the way I respond is it's a known unknown. Because we, like Dr. Cohen was saying, we're still really learning a lot about it. I will say the patients who I know who have gotten long COVID-19, really debilitating, really scary for the family. I have some patients who say, like, they have a brain fog. The way that they think just isn't normal, and it can last for so long. The other thing that's quite scary with it is that we don't yet know what the best ways to treat it are. And again, these are the types of symptoms that really impact what our children can do on a daily basis. Can they go to school or not? Can they play with their friends? Are they performing at school the way that they used to because they have this long COVID? The same way that we're seeing in adults as well. Again, these can be really debilitating symptoms that can last for a really long time. And it's scary because it's a known unknown, whereas we have a known, safe, and effective vaccine, which we know can prevent COVID, mild illness, long-term effects, acute, really severe illness. We have that safe and effective vaccine.
Last question, I promise. You identified 70% as the threshold, the target for adults vaccinations. What threshold are you hoping for children in North Carolina? What percentage? And is there a marker that you want to set for we get, let's say, this X amount of kids vaccinated, schools can start, maybe even preschools start relaxing mask requirements?
Well, we certainly want to get as many of our kids vaccinated as possible. That's why we're talking about it today, and we're doing a lot to make sure we can answer questions for parents. I want parents to know that asking questions is absolutely okay, and to get those questions answered by practicing physicians and get good information about making this decision for their family. I think when we put out the 70% number, it was back in the spring, and actually now that COVID is even more contagious, I don't think we know exactly what the right number is in terms of everyone being vaccinated. We need to have a very high level of immunity amongst everyone in order to really see this COVID become something that we can live with. So we want to see a lot of folks get vaccinated so they can protect themselves, their children, and others. So that's our focus for today. Thanks. Yes, Brian.
Hey, Brian Anderson here with the AP. Had a few questions. First on the boosters for adults aged 18 to 64. Let's say you're an otherwise healthy adult, you don't have any of those CDC qualifications, but Thanksgiving's coming up, Christmas is coming up, maybe you have unvaccinated relatives or you're planning a flight or something. What would be your recommendation for these otherwise healthy adults? Should they get a booster now?
Sure. So first, I would say anyone who has gotten the Johnson & Johnson vaccine and it's been more than 2 months, no matter your age, you should be getting a booster. So if you got Johnson & Johnson, and as folks know, I did get Johnson & Johnson a number of months ago, so I did get a booster. So Johnson & Johnson, everyone should get a booster. On Pfizer and Moderna, we are saying that it is really recommended for those over 65 with underlying medical conditions and for those who may be at higher risk of COVID exposure. So I think that could either be in your work setting or in something that you're doing in your personal life. So I think that there is some opportunity for folks to assess their own risk and to know whether or not they are at higher risk for exposure to COVID and whether or not booster is right for them. And again, it has to be 6 months since you are fully vaccinated for Pfizer and Moderna.
How many North Carolinians have gotten any of the 3 available boosters?
I don't have those numbers in front of us, but we can get that to you.
And one more question on the booster. We know there's some interest in mix and match, and you said you've gotten the Moderna,
I did.
having received the J&J. Would you recommend anyone get a Moderna because it's been proven to have the highest level of antibody resistance, it seems?
So what I would say, I think that the Pfizer and Moderna vaccines operate very similarly. They use a very similar mechanism to teach your body to recognize COVID. So if you've gotten a Moderna or a Pfizer, I would probably stick with what you've gotten before. For those who got Johnson & Johnson, we do see some preliminary evidence to show that changing over to either the Moderna or Pfizer gives you a slightly stronger immune response. So that's why I chose to move over to the Moderna. But I think it's pretty equivalent. I don't think we have the precision to say if you got Moderna, go to Pfizer, or Pfizer back to Moderna. I think they're pretty equivalent. The one scenario that I said is a little different is if you got Johnson & Johnson, potentially getting either Pfizer or Moderna.
And you said 24,000 kids have gotten it from 5 to 11 so far?
That's right. So we've been vaccinating about 5 days now, and we've done about 24,000. We think there's more out there. It takes a little bit of a lag time, but about 24,000.
And with that number, that's 2 to 3% of that age cohort.
Yeah.
How concerning is it that it's so small right out of the gate? And we know soon there's going to be almost 500,000 doses available, and 24,000 seems to barely scratch the surface.
We are at the very beginning of this work. That's exactly why we're here today. It's why I'm sharing the story about my family's decision to get vaccinated over the weekend. It was just authorized, a few days ago, and so we are still, expanding our operations. Parents have to think about, making time for it, and I think it's a great conversation to have around the dinner table this week, and then plan in the next week or so to make an appointment, go visit one of these family vaccination sites. Go to myspot.nc.gov, find a location near you. Some have appointments, some have walk-ins.
Your department had a report that came out recently looking at the effectiveness of incentives, and it seemed that there was a signal that the $4.5 million total lottery package might not have been as effective as these $25 small perks. Are there any incentives, carrots, or sticks forthcoming with boosters, kids vaccinated, any vaccination efforts?
So, well, one, I'm going to turn over to Dr. Wong, who is very involved in writing the paper about the incentives, particularly those smaller dollar incentives, the $25, $50, $100 incentives, and why they were effective. And so we are looking at ways to replicate that we saw in our adult population. What would we be thinking about for our children population? So I'll turn it over to Dr. Wong to talk about those. But yes, we are looking at that right now.
I think as Dr. Cohen has described, many times, it's all about using multiple strategies, right? We want to get as many North Carolinians, kids, teens, adults vaccinated. The paper that you're referencing, I think, is the one where we were studying the impact of our summer cards, our guaranteed small financial incentives, where we were really pleased to see that they did have an impact on reducing the rate. This was over the summer when our rates of vaccination were declining. And in the sites where we were offering those cards, particularly early on, which is when we did the study, we saw that it really slowed by like half the decline in the rate of those vaccinations, which was wonderful. Even better in many ways, we also were able to do surveys and partnering with our with colleagues at the North Carolina Central University. And what they were able to show in the surveys we were doing is that, in particular, it seemed to promote access and cover the cost of vaccination, like transportation or childcare or lost wages, particularly for some of our historically marginalized populations, so folks who are low income, Black, Latinx. And so we were really pleased to see that. We are continuing to study the impact of some of the other incentive programs. And then I'll just add, certainly those were incentive programs that we in the department we're sponsoring and running. We have seen so many of our vaccine providers partnering up with businesses and foundations and just individual citizens, really creative opportunities to offer lots of different types of incentives, some that are going to appeal to different groups, right? We have some incentives for free tickets to an amusement park. We had one vaccine provider who had a car donated and they raffled off a car, right? So I think, one incentive is not going to work for everyone and one strategy is not going to work for everyone. So it's about putting them all together.
Follow up for you on that one. Was there a single person you're aware of who got the vaccine because of the $1 million lottery? It seems there's evidence that lots of people got the vaccine because of the $25 cash card, or at least went to those locations. But is there any evidence that a single person in North Carolina got the vaccine because of the larger lottery?
I think certainly anecdotally we've heard from folks that, that was certainly a big motivating factor, just that extra nudge that they needed, extra motivation that they needed. And again, we're still continuing to study the impact of that particular larger incentive.
And last one for Dr. Cohen. This is off of what Jonah said, just sort of about the messaging to parents for the 97% of parents plus who have not had their kids vaccinated yet. You said now's an okay time to be asking questions at the start of it. What's your message to parents who got the vaccine themselves and say, I'm willing to take a chance with me, my husband, and try a new vaccine, but it's too soon to do it for my kids?
Well, I want to make sure that folks can get their questions answered. What I would say is call your pediatrician. And all I can share is what I would do for my family, which is exactly why we shared the PSA we did today. So as a mom, as a physician, and the leader of our health and response work in COVID, I got my kids vaccinated within a couple days of this vaccine being available. And I think that's I'm not just talking the talk, we're walking the walk in our family because it's so important to protect our kids. I want the best for them. I want them to be healthy and safe. And so I hope with other families seeing what we are doing for our family, that it will give them more comfort to say we can take that step forward. But I would say, of course, ask questions, call your pediatrician, and find an access point soon.
Any Lucette Grace desserts for the kids?
No, but they did get some chocolate milk after getting vaccinated. All right, I think we're going to go to some questions on the phone.
Our first question is from Richard Craver with the Winston-Salem Journal.
Yes, Secretary Cohen, this is Richard Craver with the Winston-Salem Journal. My essential question was already been asked, but I was just going to kind of follow up on the 5 to 11s. Do you have any kind of idea what time frame you're looking to see in terms of demand for the vaccinations for the 5 to 11-year-old to get a gauge for what demand is? And how would that compare to the time frame that you kind of viewed for the 12 to 17-year-olds?
Well, thanks, Richard. What I would say different from our adult is that we have plenty of supply here. We also have plenty of access points. So early on, back in January of 2021, you couldn't really get access to a vaccine because the eligibility was limited. For kids, it's widely available, plenty of supply, and lots of access points. So I think we're just wanting to get the message out, answer good questions, and really understand where bottlenecks might be. What I would share is obviously kids are in school Monday to Friday, right, during the day. So we really have to think about evening hours, weekends, and so I think it will look a little bit different in terms of the flow of when children will get vaccinated. And so we just want to answer good questions, have access points out there, and make it easy for families to take advantage of this vaccine.
Our next question is from Rose Hogan with NC Health News.
Hi, folks. Thank you for taking my question. Some of my questions have also been answered. So, but I do want to know, in terms of kids getting their COVID vaccines, do we know if they can, get a COVID vaccine alongside another vaccine, in an office visit?
Sure. Why don't I turn it over to Dr. Wong to answer that?
Thanks so much, Rose, for the question. And the answer is yes, they sure can. We know that we want to make sure our kids are vaccinated against all the different diseases that we can protect against. Certainly in the season we're in now, we really hope that everyone is getting their flu vaccine, and it is totally fine to get the flu vaccine as well as the COVID vaccine at the same time. And there are other routine childhood vaccines that can be given at the same time, making it more convenient for parents.
Great. Next question.
Follow-up, Rose Hogan, NC Health News.
And can you folks review what we know about transmission from children to their, say, older relatives who might be unvaccinated? Or what do we know now? I mean, I'm sure the science has advanced somewhat.
I'm gonna let Dr. Wong do that one as well.
So what we know is that kids are very good transmitters of any virus. COVID is not different than the other viruses that they pass around. Certainly, we've seen our kids do very well at learn to do things like wash their hands a lot and wearing masks when they're in public, when they're in school. But certainly we know, and this has been true from the beginning of the pandemic, but we know that kids are certainly a part of that transmission pipeline. Certainly also particularly within households when we're thinking about these younger children. And again, when I have patients who I've diagnosed with COVID-19, and you're looking at a 5-year-old in a family, and you're thinking, okay, well, the 5-year-old's diagnosed. It's very hard for parents and other people in that household to truly isolate away from a 5-year-old, because obviously they still need a lot of support just because they're only 5 years old. And so certainly we know that kids are passing the virus to other children, to adults that they're around, and certainly very concerned if they're passing it to others around them who are unvaccinated. I'll just also put in a plug. We still have younger children who are still not eligible to be vaccinated, and we know that some of these kids in the 5 to 11-year-old age group have younger siblings at home. My daughter was really excited about doing her part. We also got our kids vaccinated this weekend. I have a 5 and a 7-year-old, and they were really excited not only about protecting themselves, but we have neighbors who live next door who have younger children, and they were really excited about doing their part to protect some of those younger children.
Great, thanks. Next question.
Our next question is from Chloe Leshner with WCNC.
Hi, thanks so much for taking my question. I have a question about booster shots. Now with Pfizer asking for authorization for everyone 18 and older to get a booster, do you have any concerns that that might be even more of a turnoff for people who haven't even gotten their first doses, now knowing, okay, it's not just 2 shots, it's 3, and then possibly, boosters after that? Thank you.
Chloe, I think the important thing for unvaccinated folks to know is that you are 4 times more likely to get COVID if you are unvaccinated, and 20 times more likely to die of COVID if you are unvaccinated. That means 2,000% more likely to die. I don't want any more unnecessary lost lives to COVID here in North Carolina or anywhere across the country or the globe. Now we have a safe and effective vaccine. Yes, our immunity can wane over time. This virus can change over time, and it might mean we need boosters over time, but you really need to protect yourself with that primary vaccine. It is safe and effective, and we want to do everything we can to make sure we're answering questions that folks feel comfortable getting vaccinated. It truly does protect and could save their life. Next question.
Our next question is from Derek Dellinger with Fox 46.
Thank you for taking my question. This is Derek with Fox 46 News. Now, Mecklenburg County is one of among several counties and municipalities in the area that still have a mask mandate. They decided to change their guidance earlier this week to reflect if it's under 5% for 7 days, they will end their mask mandate. First off, I want to get your reaction to that. And also, we had a chance to talk to some businesses, and they are still interested in keeping up their mandates, and they kind of want to see what kind of support they can get from the state or at least from local authorities on that and what they can expect to see once some of these local mandates end.
Sure. Well, first, we haven't had a statewide mandate in quite some time, but we have had local mask mandates. And what we know from our trends is that we still have a lot of virus here in North Carolina. As I mentioned right at the beginning of this press conference, we are still in what the CDC designates for us as the red zone, meaning the highest level of viral spread. Now, we're going down. We might be in orange soon, which is a good news, but we still have a high level of viral spread. And we want to be protecting each other and ourselves. So I would still encourage folks to be wearing masks in any public indoor setting. I think that our local entities can continue to look at their local trends, look at the state trends. And as we continue to come down, I do think that it is right to revisit whether or not mandates are necessary, but we're not quite there yet. I think we're focused on making sure folks can take advantage of vaccines. Vaccines are what is going to put this pandemic in our rearview mirror officially. So that's why we're focused on getting everyone vaccinated, and I think it'll help us continue our trends in the right direction and allow us to move away from needing to wear masks as much. But we got to do the work on vaccines. Thanks, Derek.
Follow-up, Derek Dellinger, Fox 46.
Within that same vein, how the big thing that's been happening over the last few weeks or so, or at least some of the news that's been going out, has been this treatment bill for COVID-19 that has been known to reduce deaths and, for that matter, some hospitalizations. How closely are you watching this right now and know what's going through the approval process? And do you think this is something that may likely end whatever remaining local restrictions that are out there once it's approved?
You know, as we've tried to fight COVID-19 over now nearly 2 years, different phases of this have presented us with different tools. We are at so much of a better place right now than we were a year ago. We have vaccines, we have some treatment, we know how to prevent the transmission of this virus. With the fact that there is more treatment coming down the pike is great news. It's another tool. Up until now, treatment has really been either an infusion or injection, which does limit the availability of those treatments. With a pill that could be more widely available, again, I think another great tool to help us put this pandemic in our rearview mirror. It's not available yet, and still vaccine is the best mechanism to protect yourself. Again, love having more tools. Think having a pill to treat COVID does, again, get us closer to really putting the entire pandemic in our rearview mirror, but we're not quite there yet. All right, do we have anyone else on the line?
Our next question is from Jason DeBruin with WUNC.
Hey, Jason DeBruin, WNC. Thanks for the question. Nice to chat with y'all again. My question, two questions. They're around the testing program in K-12 schools, and the first is around nurses. I know DHHS gave some funds to districts around the state to hire nurses, but districts that we've talked to, and as I'm sure you likely know, it's difficult right now to hire nurses. As with other lines of work, obviously there are workforce shortages, and you probably have seen the Sheps Center just recently projecting a shortage of really as many as 10,000 or even 20,000 nurses. So the question is, how can you ensure that you'll be able to sort of follow through on this promise to hire all these nurses and put them in schools? And how would it affect the testing program if schools can't hire these nurses?
Jason, great question. I think you are absolutely right in saying we are certainly seeing a shortage of nurses across North Carolina, and that is not unique to our state. That is happening around the country. And so it is more challenging to find nurses who are able to be in our schools, but we're also at the very beginning of that process. So I think there's more work for us to do before we say it can't be done. So we have a lot of work to do with our school systems to make sure that we are getting more nurses into our schools, which is great. We anticipated that and now made sure to have testing resources available to schools through vendors that we can pair with our school districts. And so our schools are able to sign up with a program with the state. It is free to the schools, and we do supply both the tests and the folks to help them do the test. So it doesn't have to rely on them hiring a nurse to participate in those testing programs, but ideally we want both, because this isn't just about testing with our school nurses. We know our school nurses need to be there to help our student body for a variety of things, including some of the mental health things that we are seeing in our student population. So school nurses is still a top priority for us. It is going to be a challenge like finding nurses is everywhere, but we're working together with our school districts on that.
Follow-up, Jason DeBruin, WUNC.
Yes, thanks for that. And the follow-up is maybe just to grab a comment or two on the testing program in general. This is a big undertaking. As you say, you have the vendors, but it's still a pretty big job to try to test this many students. Can you talk a little bit about how it's going? I know that we're hearing it's supposed to be sort of up and running by the end of November. It feels like maybe this is something that would have been better to have up and running at the beginning of the school year. Talk a little bit about maybe why it wasn't ready at the beginning of the school year and where things stand now.
So I would say our schools have done so much to protect our children and are really doing so many things across the board. And we recognize that testing is yet another thing we're asking them to do in addition to the lots of other safety protocols. So certain school districts were certainly ready to work with us right when school started, and we did work with them. And frankly, we're working with them in the last school year. But others needed more time to sort of get ready to do this. And because as you said, this is work that they need to integrate it into what is happening within their school, whether they're doing it on site, using a vendor. So there are logistics that need to be worked out, as well as parental consent. All of those pieces are important pieces of the puzzle here. So as I said, some school districts really out of the gate doing this, and others are certainly just coming online now. I think it's an important part of our being able to keep kids in the classroom, which is our goal. We want kids to be learning and in the classroom. So if they have any symptoms of COVID, getting a rapid test right on site so that they could, if it's negative, they can go right back to class. Like, that's what we want to do. So kids are in the classroom, as well as surveilling for the virus to make sure we're keeping everyone safe and healthy. So those are our goals. We share them with the school districts, but it is, they have a lot going on, and I appreciate that, and we'll just continue working with them as fast as we can.
Our final question is from Patrick Thomas with Spectrum News.
Hey, Dr. Cohen, good afternoon. I guess this is for you and Dr. Wong. I'm curious about the new Delta Plus variant, and it's going to be more transmissible. What do parents like yourself need to keep in mind with the onset of this new Delta variant, with the original already being so contagious?
Well, thanks for that question. So we know this virus is changing. We saw it change over the summer and become more contagious. There is another what's called Delta Plus or other types of variants that are out there. So far, we haven't seen very much of that here in North Carolina, which is good, but we're certainly keeping our eye out for that. I'll turn it over to Dr. Wong.
As Secretary Cohen was saying, we really want to put this pandemic in our rearview mirror. The patients I see, the parents I see, everyone's in the same boat, right? Especially the kids. They really want to put this behind them. By getting more of our kids, teens, and adults vaccinated, this is what's going to really help us to prevent more and more of these variants from coming to be, and then really affecting the way that our kids and we're able to live our day-to-day lives. And so this is why it's so important to not wait to vaccinate, because we know that we've got this safe and effective vaccine. Parents are asking me, like Dr. Cohen, should I do it like right now, or is it okay for me to wait? I think, the thing that I always advise them is, I'm a parent too. We're all always trying to make the best decision for our kids. If people still have questions that they want to get answered by someone that they know and that they trust, please reach out to those folks, children's healthcare providers, others who are trusted in your community, so that you can get those questions answered, so that we can get as many kids vaccinated just as soon as possible.
Okay, I think that was our last question. Thank you so much for tuning in. Again, we hope everyone gets vaccinated and stays safe. Thanks so much.